So go ahead.
Okay, I am Dr.
You're looking right at me.
Yeah, I am Dr. Deodatus Cyril Oike. I am an orthopedic surgeon serving here at Tenwek Hospital in Bomet County in Kenya. I also am among the faculty in orthopedics program, PAACS, and also work as the assistant program director, Tenwek Orthopedic Program.
Great. So what made you want to become a doctor?
I think it started way back when I was a little uh, boy, and I used to have an uncle who was a doctor, and I would see the amount of respect that he used to receive from the community by him being a doctor and how much he'd help. So when I started at first, it was mainly, I'll say it was selfish in terms of I wanted that pride, but now after I started the whole thing, I realized it's a big journey, and the people that you help, you really have an impact in a lot of people. Yes.
Hmm. And was one of your motivations to be able to help people?
Yes. So once I started my medical journey and I was in medical school, I happened to go for a medical camp in a very rural area. And when I was there, that's when I noted there is need for doctors, and it's not about all the glory and the hullabaloo of living in the city. It's more about how can you help more people in rural communities. And that's when it dawned on me that I may be of more help if I worked in a rural area more than working in a city where I grew up in.
Hmm. And you're from Kenya?
Yes, I'm from Kenya.
Oh, okay. Um, how did you first hear about the PAACS program?
So when I was doing my internship, I was in Vihiga. There was a consultant who joined us at Vihiga, and he was from Tenwek PAACS program. And it happened that during the period that it was there was a doctor strike at the hospital, but he didn't participate in the strike. He took care of his patients and even offered to pay the nurses so that they can take care of the patients post-op. And that's when I felt I really need to train where this person trained so as to have that kind of culture ingrained in me, even when I finish my training.
Wow, that's a great story.
Yes.
Yeah, that's exciting. So looking back, what was the most important part of your residency experience?
I think having worked in government setting, whereby there was that clear demarcation in terms of your spirituality and your work. When I came over here, something which really enticed me is how it is intermixed and it works perfectly. Because I do remember when I was in first year, it was like my first experience, and we were in clinic with a consultant. And I do remember after we had clerked the patient, we had discussed the patient, and it was a horrible diagnosis. And when the patient was broken down, the consultant first of all shared the good news of God, and we prayed with the patient. And after that, that was like a light into me, like you can have this also being practiced in your work. You don't have to have a demarcation between being a doctor and being spiritual. You can intermingle them, and that's where I saw the light of PAACS in terms of training surgeons who see the importance of mixing our spirituality with our work and not separating it.
Hmm, that's great. So, yeah, one of the important things that like they talk about in PACS are the two tracks. Not only is it uh, medical excellence in surgery training, but also discipleship. Why do you think that's important?
I think, especially for us as Christians, our main task which Christ left for us was to go and make disciples. So, with PACS intermingling that discipleship and also excellence in training, it's basically we are able to live our passion of serving people, but at the same time, we're able to even fulfill the great commission that we were given of going and making more disciples. And we are privileged as doctors that we don't even have to go to the field. They do come to us. So if you have that element of making disciples, you are at an advantage because they will come to you and you'll be able to disciple to them.
That's great. And doctors have a unique advantage because when people come to see them, they're vulnerable and prepared to receive the healing and hope of the gospel. Can you talk about some of that?
Yeah, I've noted that to be true. As I stated, the previous doctor who we shared the word with the patient, after we had that event, he was sharing with me and he told me there is never a day that is requested to pray for a patient and the patient has denied. And that was also a light to me because uh, there's never a time a patient will come and they'll be like, no, don't pray for me. No, don't share the word. We have that advantage that we don't face that kind of resistance. I think it's more of our fear to share the gospel and to disciple the patients. But in terms of patient being receptive, they're always receptive of what you want to share with them.
That's great. Do you have a patient story that you remember that has impacted you?
Yeah, there are quite a number of patients who have impacted me, but there's one, I remember a girl who presented to us where she was about 7 years of age, and when she came, she had been managed at another facility, but they were not able to manage the patient well. So when she came, she was at risk of having an amputation. So I do remember the father was really distraught because he was wondering, why didn't I bring her earlier to us to be able to manage? But through it all, we were sharing with him the word, just telling him there is a purpose for this. And after the whole journey, it took a long time for this patient to recover fully, about 9 months of just having surgeries, clinic visits, admissions to hospital. But I remember after the 9 months, the father was like, I now understand the purpose, because even his faith had grown because he was able to interact with us and we were able to share the word with him. He was able to interact with the chaplains in the hospital, and he was saying it has even grown his faith. He's not the way he was before the incident. And I think that was really wonderful to me, that not only were we able to save this patient's leg, but we also were able to build their spiritual aspect, which is even much more important for them in the family.
That's great. Wow. Um, so what led you to come and work with PAACS as a consultant?
So after I was fortunate to join the PAACS program, the training over here and in PAACS sites, it's just wonderful. You have people who volunteer their services and they're at the top of their careers, but they volunteer, they come work with us, and it's like you're having these mini fellowship programs every time these people come and you're training with them. And I was like, if people can volunteer from away from Kenya, their services, the whole month they're with us, they're away from their families. I think it's not hard for me to even volunteer and make sure that the programs still remains. And I think that is also my passion, that not only do I want to practice as an orthopedic surgeon, but I also want to have PAACS programs which function so as in the future someone else may come and train with PAACS, and the whole concept of PAACS, making Christian surgeons, may continue for years to come.
That's great. How does it make you feel to be able to pass on the things that you've received to a young doctor in training?
I think usually feel like it's a whole privilege to be able to pass whatever I've learned, because I've been bestowed with great resources in terms of the training, in terms of even the facilities which have been given, the best of resources as which can be given in anywhere in this country. And passing it to the next generation of surgeons, I feel like I'm privileged to do that, because I'm now participating in molding a future surgeon who will also be a Christian surgeon and will impact another person. So it's like with training here, working here, training other surgeons, I'm having the advantage of spreading the impact, not only in the people I'm training, but also in the people they will train afterwards. So it will be a expanded impact.
Wow,
Yes.
that's great. Do you have anything you would like to share?
I just want to share that we do appreciate a lot what PAACS has been able to do for us in this country, in this region, in terms of the best of training that can be offered. And apart from the best of training that can be offered, the spiritual aspect, that now we have Christian surgeons who are proud Christian surgeons who can pray before a case, and it doesn't seem like it's an odd thing, because there's this group of Christian surgeons who we are strengthening each other, discussing with each other, and it's basically a whole community which has grown from just a tiny seed of PAACS, and it's impacting the whole country.
Wow.
Yes.
So what's your vision? PAACS is celebrating 30 years. What's your vision for PAACS in the future?
My vision for PAACS in the future is how even PAACS, we can have even local, like here in Kenya, Kenyans who are actively participating in PAACS in terms of fundraising, in terms of helping the different institutions which are training, that we may have even a local impact for PAACS. For the disciples who have been discipled at first, they may be able to now create local disciples. So as the spirit of PAACS continues spreading and does not die with us or with the next generation, that it may continue years and years. And these 30 years may be just a blimp in it, and we may have 60, 80, 100 years of PAACS.
That's perfect.
Yes.
Thank you. What do you see as the long-term impact of PAACS on the entire African continent?
What I may say, the PAACS trained surgeons, apart from the spiritual aspect, they're usually top-notch surgeons in whatever places they are trained. Any region you visit and there is a PAACS surgeon, he'll be noted that that is the best surgeon that is over there. So I can say PAACS has, it came in a small way, but it has impacted the quality of surgical care around Africa. Because everywhere there is a PAACS surgeon, there is improved quality of service. There's also that compassionate care. So I'll say it has had I don't know if when they started PAACS they thought of this, but it has had a very big impact in terms of the quality of surgeons that are now practicing around in different areas, not only in PAACS sites, but even in other hospitals, both government, mission hospitals. There has been a change in terms of the quality of surgeons working in those facilities.
Wow, that's good to hear.
Yeah.
So how would you say thank you to the people that supported your training, but also PAACS, ongoing PAACS? What would you say to them?
I'll say I appreciate a lot what you guys have been able to do, the sacrifice you've made. It's not in vain. And I'll say it's my vision that whatever sacrifices that you did make, that it continues to bear fruit, with us even continuing to work in this facility, training more surgeons, and making sure that the dream you had when you are making that sacrifice may continue to prosper for future generations.
Wow, that's great.
Yeah.
I can't think of anything else. Can you?
No.
Okay.
Okay.